Hi Nisha, how are you?
Good. How are you?
Good. My name is Mandy and I'll be your nurse today. How are you doing today?
Good.
Okay, today we're going to be doing your complete physical examination.
Okay.
So I'm just going to start off by checking your hands. If you can go ahead and put your hands up for me. Thank you. And I'm just checking, starting the physical examination with just checking your hands, your nails, the capillary refill, which is good. Your skin color looks good. The texture, the skin turgor is good. Okay, that's really good. The skin texture and the moisture is good. I don't see any lesions anywhere, which is a good sign. And now I'm going to go ahead and check both of your radial pulses. You can rest them on your lap. Okay, and your radial pulses. Alright. The normal pulse range is anywhere from 60 to 100. And yours is 60, which is within normal range. And I've been observing your respirations, which are normal as well. They're anywhere from 12 to 20 respirations per minute for a normal adult. And yours was within normal range. And the next test I'm going to be checking is your head. We're going to start off with your head. Just relax like we it's going to be checking your scalp. I'm checking and feeling for any lesions, any abnormalities, your hair, your cranium, checking for any lumps or bumps.
Feels good.
And your hair is very beautiful and thick. It's not thinning out, which is
Thank
really
you.
good. So the scalp is good. Now I'm going to check your cranial nerve 7, which is for the face. So if you can go ahead and smile for me. Okay, frown. Good. Raise your eyebrows. Good. So that's really good. Your when you smiled and when you frowned, your face was symmetrical. There was no deformities, which is good. Okay, now I'm gonna feel your temporal arteries. Okay, good. I'm moving down to feel the temporomandibular joint. Okay, can you go ahead and open your mouth? Close. Good. One more time. Close. Okay, good. So I felt your joint move when you opened your mouth, which is good sign. Now I'm going to be pressing on your face. Let me know if you have any pain. I'm pressing on your maxillary sinuses. Did you feel any pain? Okay, good. Now I'm going to feel the frontal sinuses. Let me know if you're having any pain. No? Okay. Now I'm going to be checking your visual field. And the first test I'm going to be doing is it's a test by confrontation. So I want you to go ahead and cover one of your eyes. Yeah. So cover your left eye first, and whenever let me know whenever you see my hand come closer. Just let me know when you see it. Okay. Good. Now the other eye. Okay. Okay, good. So that was good. Okay, now I'm going to be checking your extraauricular motion with the light. Let me get the light. Okay. All right. So I'm just going to be assessing. Okay, good. I'm just assessing your corneal reflex, which is good. Okay, good. Now I'm going to be checking your extraauricular function of your eyes with the parallel traction, which I already just did, and the test that I was performing, that was the parallel traction assessment, and now I'm going to be doing the cardinal position of gaze, and this checks cranial nerve 3, 4, and 6. So I want you to just follow my pen, okay? Okay, good. Okay, now I'm just checking the external structure of your eyes, your eyelids, your eyebrows, your eyelashes. Let me see. Okay, I'm checking your sclera, which is white. It's good. Your conjunctivitis is clear, which is normal. Your cornea and iris look good. Okay, good. So the external structure of the eyes with the normal range. Okay, now I need you to, okay, let me get my light again. Okay, I want you to look right here. And now I'm going to be checking your pupils. I'm going to be checking the size of the pupils and the shape and the quality. And when I flash the light, the pupils, they're supposed to react with light briskly. Okay, so I'm just going to do that with both eyes. Good. Okay, good. Let me do it again. Good. Okay, good. Okay, so that was good. And now I'm going to be checking for accommodation. And okay, so look at the pen, and I want you to just keep your head straight and go ahead and look at the wall to your right. Good. Now look at the pen. Now go ahead and look at the wall to the left. Good. Now that was the test for the accommodation, which is really good. You did good. And if I had an ophthalmoscope which checks inside the eyes, and I would be able to check for any red reflex test. I would be able to visualize your disc, your vessels, your retina, your macula, and the retina background to make sure it's within normal range. And now I'm going to be checking your ear. I would usually have an otoscope to check it with, but I'm just going to be checking it with the light. Just put your head straight. Good. Just keep your yeah, I'm just looking inside your ear and making sure the ear canal is clean, no redness, swelling, discharge, any abnormalities. I don't see any. Okay, looks good. And the tympanic membrane, which is also like the eardrum, it's supposed to be a pearly gray color. And that's what yours is, so it's normal. No discharge, no bleeding or anything unusual. I didn't notice anything, which is good. And also the external, the outer ear, it's good. The auricles are movable. And I'm going to put in your targus. I don't feel any tenderness. Do you feel any pain here?
No.
Okay, good. Okay, I don't feel any tenderness. Okay, so now the next test I'm going to be checking it would be with a tuning fork. It looks like a fork. It's a metal material, which I don't have access to, but I'm going to try to hit this on my hand, and you're supposed to feel a vibration on top of your head, so let me know when you feel it, okay? It might be faint. I'm going to put this like this, and you're supposed to feel the vibration. And you're supposed to feel the vibration, so let me see if you feel it. You might not because I'm doing it with the pen, but that would be the Weber test. So, yeah, I don't think it's going to work with this. But that's how you would do the Weber test. And also there's another test called the Rhine test, and with the tuning fork, I would put it right here behind the mastoid process, right here behind the bone, and it would check for ear conduction, and you would be able to hear the vibration. And I would also just bring it right here closer to your ear, and that would check for the air conduction of the ear. Okay? And now let's see. The next thing I'm going to be checking with the light is inside your nose, your nares. Okay, good. I'm checking your septum. Make sure it's not deviated. I don't see any lesions. And your nose is symmetrical, which is good. And also, if you can go ahead and close your right nose, okay, the right side of the nares, and breathe in. Good. I'm checking for the patency to make sure they're open. The other one. All right, good. You did really good. Okay, now, so I already checked the inside of the nose, your mucosa, the nasal mucosa, everything is good. I didn't see any redness, no discharge or anything, any lesions. And now with the light, I'm going to be checking inside your mouth. So go ahead and open your mouth. Yeah, you can put it straight. Good. So I'm checking your teeth, your gums. I don't see any cavities. I don't see any lesions inside your mouth, which is good. Your tongue it looks good. It's pink. Go ahead and raise your tongue up. Good. The floor of the mouth looks really good. The buccal mucosa is good. And your palate on the top, your hard and soft palate look really good. And go ahead and stick out your tongue. Put your head straight. Okay. And I'm going to be checking for the cranial nerve 9 and 10. So I want you to stick out your tongue and say ah. And when you say ah, I'm going to be watching your uvula, make sure they move. So stick out your tongue and say ah. More? Stick out your tongue. Okay, good. So I saw your uvula move, which is good sign. And, okay, let me see if I have this. Okay, now I'm going to check your, go ahead and open your mouth. Good, I'm just going to check your gag reflex. Let me see, come here. I'm just going to do it. Stick out your tongue all the way. You're just going to like gag. Okay, good. So that was her gag reflex, which is good. That was normal. And now I'm going to be checking your cranial nerve 12. I want you to stick out your tongue. Just stick out your tongue. Okay, good. All right, good. So that's good. Your cranial nerves, all of them are working. They're within normal range. And I don't have any gloves right now, but if there was any lesions or any pain you were having in your mouth, then I would put my gloves on and check and feel inside your mouth. But I didn't see any lesions, and you aren't having any pain. Your gums look really good. So your mouth is really good, okay? And now I'm going to be checking your neck. So if you can just move your head, just sit up straight. Good. Okay, I'm checking your neck now for symmetry, which is good. I'm also checking your pulsation. Okay, which is good. Okay, now I'm going to be checking the lymph nodes in the neck. So first I'm going to be checking the cervical lymph nodes. It's right here. And I'm checking to make sure there's any swelling and your lymph nodes are not enlarged. Okay, now I'm going to check the pre-auricular lymph nodes, which are right here in front of the ear. Okay, your posterior auricular and the occipital, which is here in the back of the head. Okay, right here. Just put your head straight. Good. Okay, under the chin, the submandibular lymph nodes and the submandibular lymph nodes. Okay, now I'm gonna be feeling this. Just put your neck straight. The superficial cervical nodes. Okay, now I'm going to be checking the deep cervical chain right here. These nodes here. other side. All right, and right here, go ahead and shrug your shoulders for me, and I'm going to check your right here, your subclavicular nose. Okay, good. Go ahead and relax. Make sure it's on. Okay. Okay, so the next test I will be doing is I'm going to be inspecting and palpating your carotid pulse. And I'm going to be doing both sides one at a time, okay? Okay, good. Okay, good. So the carotid pulse is good, and now I'm going to be listening to the pulses again, and I'm going to be checking for any bruits, which are any abnormal sounds that I might hear, okay? Okay, now I'm going to do the same test with the bell of the stethoscope, because with this you hear any extra sounds better. Okay, good. Okay, so that was good. I didn't hear any bruits or anything. Now I'm going to be checking the range of motion of your neck. So if you can, just go ahead and move your neck forward. Okay, back. All right, and now go ahead and turn your neck to the side. Now the other side. Okay, good. And shrug your shoulders. Okay, release. All right, good. Now we're going to do the same things, but see, I'm going to be using resistance to make sure that there's strength in the muscles. So same thing, just move your head this way. Good. The other side. All right, good. Now, I want you to shrug your shoulders. Okay, good. So the muscle strength was good. I felt resistance, and that checks the cranial nerve 11. Okay, now I'm going to be checking your thyroid gland, so I'm going to go behind you. Okay, I'm going to go behind, oh, sorry. Okay, perfect. I'm going to go behind you and go straight, okay. So I'm just going to put my hands right here. Okay. You can, yeah, move straight. Put your head, okay. I'm going to put my hands right here on the sides, behind the trachea. And when I tell you to, if you can just go ahead and swallow for me. Okay, let me see it this way. Move your head to the right. Okay. Go ahead and swallow one more time. All right, that was good. So I felt your thyroid gland, which is good. And also, your trachea is good. It's within its midline. It's symmetrical to your body, which is good. Okay, now I'm going to be checking the posterior and lateral chest for configuration of the thorax cage, which is, if you can go ahead and turn this way. Okay. Yeah, that's fine. Okay. So I'm just going to be, okay, I'm just going to be, okay, if you can sit like that. Okay, I'm just looking at the skin characteristic. I'm looking to make sure it's symmetrical, and the shoulders and muscles, everything is symmetrical. Okay, now I'm going to be checking the chest expansion. So if you can go ahead and take a deep breath and relax. Okay, one more time. Okay, good. So that was the chest expansion, which was good. Okay, now I'm going to be checking for tactile fremitus. So whenever I place my hands and you feel me move, just go ahead and say 99, okay?
99. 99, 99.
Okay, good. And now I'm going to be feeling for any lumps or tenderness. Okay, good. I didn't notice any. Now if you can go ahead and put your head forward. Okay, good. Now I'm going to be checking your spinous process. Okay, good. And now the next test I will be doing is I'm going to be percussing the posterior and lateral lung fields, okay? Okay, and here I'm going to be marking here at the different sounds that I hear to locate the liver and the lungs. And I would mark one here. And then when I hear a dullness, that would be the other mark. And on both sides, the measure of the diaphragmatic exertion is the same. Okay, and now I'm going to be, just stay like that. Now I'm going to be checking or listening to the breath sounds. So whenever you feel the stethoscope move, just inhale in and then out through the mouth, and I'm checking for any adventish sounds, okay? There you go. All right, very good. You did really good. Now go ahead and turn around. All right. Now we're going to check the front of the chest. And I'm inspecting your respirations and your skin characteristics. If we were in the examination room, I would have you take your shirt off, obviously. But the respirations look really good. Your skin color is really good, and your body is proportionate. It's symmetrical. It's good. Okay, now I'm going to be doing the tactile firmness again. So I want you to say 99.
99, 99, 99, 99.
All right, good. So that was good. And now I'm going to be checking right here for your subclavicular area for any tenderness, any abnormalities. Okay, now I'm going to do the percussion test. Just relax. Okay, good. Now I'm going to check your breath sounds in the front. And just inhale and exhale through the mouth. All right, that's really good. You did really good. Okay, now the next thing I'm going to be doing is listening to your heart. So if you can just move forward a little bit. Okay, good. Okay, so I'm going to be listening to the heart and placing the stethoscope on the right and left side of the sternum to hear the first and second sound. Okay, that was good. And I didn't detect any murmurs or any unusual sounds. Alright, the next thing I'm going to be checking is your upper extremities, the range of motion and muscle strength of your hands first. So if you can move your move your hands down this way. Okay, move them down, like just your hands. Move your hands. Okay, good. Now up. Okay, good. And now I want you to the arms. I want you to go like this. Okay, and bend. Okay, and relax. All right. Okay, good. You can put them by your side. And now I want you to put your arms over your head. The back. Okay, good. Relax. All right. And now I'm going to be just relax, palpating right here. And I'm checking the epitracheal nodes. I'm just feeling them. Make sure I don't feel any swelling or feel any lumps or bumps. Okay.